Hello everybody. Today we will discuss a rare condition, that is congenital double pylorus. This is usually found incidentally on endoscopy. The disease has a prevalence rate of 0.001% to 0.4% of the upper GI endoscopies. The first congenital pylorus was reported in 19 double pylorus was reported in 1971 by Christian et al. The absence of evidence of the peptic ulceration on endoscopy as well as negative history of peptic ulcer disease. This is important from the point of view of the definition of the congenital pyloric stenosis. This is twice common in males than in females. Etiology is usually the tubular duplication of the pylorus. Symptomatology, these patients, they are usually asymptomatic. This was the case reported by Ruvashini Naidu and Bhagwan Singh from Durban, South Africa. Here you can see two openings at the level of the pylorus with a septum in between. The acquired pyloric duplication has been reported by Jing Lai et al. And these are the photographs. Double pylorus as duplication of the pylorus is an uncommon condition that can be either congenital or acquired. Acquired double pylorus occurs when a peptic ulcer erodes and creates a fistula between the duodenal bulb and the distal stomach. So that is the genesis of the acquired double pylorus. An accessory channel connects the lesser curvature of the pyloric antrum with the duodenal bulb, and in all cases the pyloric ulcer was located in or immediately adjacent to the accessory channel. So these patients, this type of patients, they don't have the congenital double pylorus. This is about the acquired double pylorus. So what are the criteria where we can say that this is the congenital double pylorus? There should be no clinical history of peptic ulcer disease and no evidence of ulcerative changes on imaging studies either radiologically or endoscopically. And recognition should be at very young age. Histologic features including the presence of mucosa, submucosa and muscularis propria in the second channel. The spontaneous or drug-induced motility in both the channels, and or other associated congenital anomalies can be there, such as heterotropic pancreatic tissue or gastric duplication. The congenital origin of double pylorus is rare in comparison with the acquired form. So these criteria, they have been laid down by Grossfield et al. In 1970, and we can find this reference in Annals of Surgery 172, 83, 90 issue. This is one video which we came across where there was classical double pylorus. So we started doing endoscopy, and this particular finding, patient was having GERD symptoms, and we can see the grade B or grade C type of esophagitis there. The Z line was at 35 centimeters. OG junction was around 38 centimeter. So we entered the stomach and we can see the pyloric opening there, and we entered the pyloric opening, and lo, again there was a second pylorus there. So we, for the sake of proper diagnosis, we again did this procedure 2 or 3 times, and for recording purpose we went in slowly so that properly we can see the first pylorus and a second pylorus there distally, a completely normal looking pylorus 2 in number, and then we entered the duodenum from there. So this was a classical case of congenital pylorus with similar looking two pylori. So duodenum was normal and the second pylorus entered the duodenum. The first pylorus entered led to the second pylorus, and then second pylorus entered into the duodenum. So this was a case typical of double pylori, we can label it. So there was no septum here, as has been reported in the other cases. So this is a bit of more classical pylorus which we are seeing. So this is the video for you to see, a complete video showing double pylori. Hitherto reported cases of the double pylorus are essentially the septate pylori opening. Both the openings, they are entering into the duodenum. But here, in our case, classical pylorus, it was not a septum into the stomach, but it was a classical pylorus, and then it entered into an area of the stomach where again there come a second pylorus which was connected to the duodenum. So the video in this presentation clearly shows the endoscopic evidence of double pylori. Thank you very much.